Hello, good evening, everyone, and welcome to the week's Best Hospital Webinar 2021. Today, we discuss the health of our healers. So, who are our healers? Our healers are the ones that are our hospitals and the entire medical fraternity that have invested their time and sweat in the care of their patients. In the face of unprecedented health crisis caused by COVID-19, hospitals across India faced multiple challenges of access, safety, supply, chain logistics, and financial stress. All of this caused by the pandemic. It resulted in huge patient loads and fatalities, heavy financial losses, and a sharp decline in revenues. Elective procedures were cancelled or postponed to prioritize hospital capacity, while patients limited hospital visits because of concerns about potential exposure to infections. Many of them died from the lack of care for non COVID diseases. There were layoffs, there were furloughs, and salary cuts to contain costs and maintain financial viability. Yet, in the face of this unprecedented crisis, our hospitals have stood tall. They have taken the next normal to another level altogether because the next normal for healthcare will look nothing like the one we leave behind. We have covered in detail the story of our hospitals, how they stood up to the challenges of COVID-induced pandemic in our latest issue of the week, the Best Hospitals 2021. Let me now take the pleasure of inviting our first speaker. We have eminent panelists on our panel today, all four of them eminent in their own right. The first speaker whom I will now invite is Dr. H. Sudarshan Ballal. He is the chairman of Manipal Hospitals. He is also a renowned nephrologist, chairman of Manipal Hospitals Group, and Senate member of the Manipal University. He performed the first cadaver kidney transplantation in Karnataka in 2005. He was awarded the prestigious Rajyotsav Award by the government of Karnataka for his contributions to the field of medicine. Welcome, sir. Over to you, sir.
This is what I do when I'm down and out. I sing a little song of hope. Life's on, and I'm happy. There are times when life's a struggle, but wake up to that lovely cut of life's on, and I'm happy. Life's on and I'm happy now. शाम डाले फिर सूरज जागा बादल हटे तो खुशी आई शाम डाले फिर सूरज जागा बादल हटे तो खुशी आई Life's on, I'm happy. Life's on and I'm happy now. Life's on, and I'm happy.
Good evening, Pooja. At the outset, a very big thank you to the week for holding this event and organizing this function. It is indeed a proud privilege for me to be part of this this evening. As is known, COVID pandemic was truly a black swan event never seen in the last 50 years of my clinical practice. It turned the world and the healthcare industry topsy-turvy. Unfortunately, this being a new disease hit us very hard, and it was like waging a war at an invisible enemy who could neither be seen or heard. So we were in the dark for quite some time. The first wave of the disease was particularly difficult for us to manage because it was a new disease. We did not know how to take precautions to prevent the disease, nor did we have any standardized protocol for treatment, and certainly we did not have any vaccination. And because of this, we took a very, very heavy toll among the healthcare workers and the frontline workers. Not only did hundreds of thousands of healthcare workers get affected by the disease, unfortunately, thousands laid down their lives in fighting this disease and trying to protect the society. There was huge physical distress, psychological distress, and of course, a huge financial loss because most hospitals, the revenues dropped by 70 to 80%, and footfalls of non-COVID patients came down to about 20%, and the hospitals were flooded with COVID. There were huge family issues. Doctors could not go home because of the fear of spreading the disease to their near and dear ones. They were bogged down with 24/7 work in the hospital, and this took a huge, huge toll on most of the doctors and the healthcare workers, especially nurses and doctors in the front lines like the ER, ICU, pulmonology, medicine, really took a bad beating. In addition to the doctors and nurses, we had ambulance drivers, healthcare workers who had to ferry sick patients back and forth from their homes to the hospitals in a very critical state. Fortunately for us, we managed this quite well and adapted very rapidly, and within a very short period of time, India fought back and to a large extent now has conquered the disease, or at least this is the cusp of conquering this disease, which is going to be probably in an endemic state rather than the pandemic state that it was. It has taught us many lessons. I think first and foremost, in my opinion, was that we have pretty much relegated preventive and public healthcare to the lowest level of healthcare. And this disease certainly woke us up from our slumber and told us how important it is to have surveillance of the disease, look for pandemic signs early, have precautionary measures and a strong, robust public healthcare system and surveillance to face future pandemics. It also helped us in awakening the digital health systems, which for decades together were held up in the quagmire of legal and regulatory issues. Believe me, in a week, in the last week of March 2020, the digital health, which was stuck in various regulatory issues, was opened up in just a matter of 7 days. And now telehealth, telemedicine, remote consultations, so on and so forth has become the norm, and it will continue to be norm for the future. And of course, the scientists did a superb job in what would normally take about 8 to 10 years to get a vaccine produced for a new disease. Our scientists were able to get the vaccine in a matter of 8 to 10 months. And by the time the second wave hit us, though it hit us very hard, we had vaccines on board. And now, to the credit of the people and the government of India, more than 110 crores of people have been vaccinated with at least one dose. There are many lessons for the future that this pandemic has taught us, which we should not forget. As I said, public health and robust surveillance systems have to be in place. We do need to improve our healthcare infrastructure and also the healthcare personnel in the country. And fortunately for us, this is the first time after independence that I can remember where healthcare has been given the importance it deserves. I think everyone has now realized that a country is only as strong as the healthcare of the country is. And we had a massive allocation this budgetary year for healthcare services, and rightfully so. I do believe healthcare should be a fundamental right for every citizen, like the right to food, right to vote, and right to education. So I don't think this can be changed because of what has happened in the last few months. We are also moving slowly towards universal health coverage. This is the first disease where any patient, rich or poor, urban or rural, could walk into any hospital, private or public, to get care for COVID. And this has never happened before. And this is something that will stay with us. I think we are slowly going in the direction of universal health coverage for every patient of this country. And that will only happen when the public, the private sector, the people, and the insurance companies get together. Of course, digital health has gone to a new level. And I think about 50 or 60% of all consults now are in the digital consults. We have home care, remote monitoring, and I think we are moving away from brick and mortar hospitals to home care, outpatient care, day care, and only the very, very sick ones need to stay in the hospital, and that's the way it should be. Because one of the issues that we realized very early in this pandemic is before we knew about the disease, everyone was asked to rush to the hospital the minute they had COVID, and within no time, the entire healthcare system of this country was completely overwhelmed, and we had patients dying on the roads, dying at home. Later, we realized that 90% of these people could be taken care of outside of hospitals, and that's what's happening not only for COVID, it will happen even for other diseases. And we do believe that there was a significant shortage of intensivists, emergency room physicians, and pulmonologists, which we became acutely aware of during this crisis, and the government has taken the right steps to increase the number of specialists in this field, not only in the private sector, but also in the government sector. And that will go a long way in managing pandemics in the future. And of course, one of the biggest casualties of the pandemic was that non-COVID care went for a complete toss. People with kidney failure, heart failure, cancer, other non-communicable diseases could not visit doctors or the hospital. And unfortunately, either their disease progressed or many of them actually died waiting to see the doctors or the hospital. And this is something we should not let it happen in the future. And the future hospitals and healthcare should be designed where we can take both communicable and non-communicable diseases, pandemic and non-pandemic care simultaneously, in the hospitals of the future need to be designed or modified in such a way. And I do believe that we had an acute shortage of beds, nursing personnel, doctors, and healthcare workers during the pandemic. And the lesson we learned is that overnight we cannot produce a large number of personnel and infrastructure. So we should have something like what the armies of the world have, or the military force of the world have. They have a reserve force, whether it is National Guard, Border Security Force, Central Reserve Police. We should have a cadre of people and also infrastructure available where you can draw in very, very rapidly in case of a pandemic to deploy more personnel, more hospitals like field hospitals in the army, so that we are not left in the lurch, and also a lot more patient lives can be saved. All in all, COVID was a disaster for us, but in these clouds of the COVID, we had some silver linings, and these silver linings are something that we should carry on forward. Thank you very much.
Thank you, sir. That was indeed a deep insight on what we really went through. And one remark that you made is very pertinent. You said a country is only as strong as its healthcare industry is, and the healthcare of its community is, which is I think very important. You also said that success will only happen when all stakeholders come together. On that note, thank you so much, sir, for sharing your insight with us. Let me now take the pleasure of inviting our next speaker, Dr. Reshma Tiwari. She is the Chief of Critical Care Unit at Artemis Hospitals. She is also a graduate from the Armed Forces Medical College in Pune, and she served in the Armed Forces as a short service commission officer for 5 years. Thereafter, she specialized in anesthesiology with an MD from University of Delhi. She gathered a large experience in cardiac anesthesia during senior residency and moved to intensive care and quickly became a recognized teacher by the Indian Society of Critical Care Medicine. So she is now teaching the Indian Diploma in Critical Care Medicine for postgraduate candidates and post MBBS certificate course in critical care for MBBS doctors. Welcome to the webinar, ma'am. Over to you.
One facility is working towards providing better healthcare for India. This 400-bed state-of-the-art multi-speciality hospital located in Gurgaon, India, is setting new standards in healthcare with use of modern technology, world-class patient care facilities, and the best medical practitioners from across the world. This is Artemis Hospital. Designed as one of the most advanced in India, Artemis, through its 11 centers of excellence, has combined top-notch services in a warm, open-centric environment and affordability, making it one of the most sought-after healthcare destinations in India.
My dream was to create Artemis as a place when patients walk in, they know they are going to be fine. Our doctors, nurses, paramedics, our systems and processes instill confidence in our patients, and that is what you want when you are sick. The rule for every department is patient comes first. So, listening to patients, prioritizing their problems, understanding their feedbacks, and working constantly to improve our systems and processes has given us a cutting edge over our competitors and has helped us grow from a 200 to a 400-bedded specialty hospital.
Very good evening to you all. I'm very happy to be here on this very august panel, and I thank the week for giving me this opportunity. I find myself as one of the hands-on physicians, as an intensivist, where we are trying to focus on the pandemic. And I think we would also like to understand how we would keep our healers in good health as a healthcare fraternity. Having been, as Pooja introduced me, having served in the Indian Army, we had learned that our job is to keep the soldier fighting fit, and that is how the defense of our country will work. And this pandemic saw that we needed to keep our country fit to keep going, else we would just collapse. So it is extremely important, I think, to pay attention to the health of the healer itself. We do undergo various, and come across various situations that impact us both physically, mentally, psychologically. Of course, this applies at all times, but the pandemic became once in a lifetime, once in a century situation where we all had to put everything that we could together to be able to put our best foot forward and work towards it. We have always learned, when we graduated, the Hippocratic Oath, first I will do no harm. The nurses come with their background of Florence Nightingale. They try to emulate her, the lady with the lamp. Modern nursing came from there. And I think it also applies to all the healthcare workers, which would even include the F&P staff who has to visit the ICU or the wards, or the housekeeping, the general assistants, everybody. We were all suddenly exposed to a magnitude of healthcare situation that we had never foreseen, never been practiced towards, and never really knew that we would have to face someday. So in order to protect the health of our healers through such a situation, I think we need to understand that it works at every level. First, each one of us, be we a doctor, a nurse, a general assistant, need to focus on ourselves to keep ourselves going through difficult situations. Like I said, actually it applies every day, but this pandemic has certainly woken us up to it more. The second would be each of us who is in some kind of a leading role, a team leader towards a doctor's group, or a nursing team leader, or even the housekeeping supervisor, etc. All of them need to understand what they need to do when they are addressing their team. The third would be how our organization would come in. Or maybe I should say we should go in the reverse order, but I will just choose to proceed in this sequence to make it simple to all those who are listening to me. So, yes, we must protect our healers. And the first thing is that what is the kind of health assaults that a healthcare personnel can have just by virtue of being in this profession? Very simply, the impact could be physical health. We've always known that we are exposed to communicable diseases. After all, tuberculosis was all over our medical colleges, chickenpox, many diseases where we needed to protect ourselves. A lot of students during their MBBS days actually suffer the disease and come out of it. So, this is something we had been exposed to, but we had never really learned to protect ourselves and our colleagues well. The second is, of course, things have now become more streamlined, and through needle stick injuries, the healthcare personnel are often exposed to diseases like HIV, hepatitis, etc. Hospitals have now begun to set in place situations where we can handle this. And of course, there has been a new phenomenon which was not there earlier, and at least we had not heard of it, maybe because of lack of news or social media. But doctors actually facing trauma, polytrauma situations because of assault is another thing that has come up as a great healthcare issue for our healers. We need to put in place our own strengths to be able to handle this situation. The larger number, of course, is doctors and other healthcare workers facing psychological issues. And these could be immense. And we realized it, as I said, even more during the pandemic. Some of us, when we realized we could not keep pace with what was happening, felt a loss of self esteem, felt that we might affect our reputation, even if after coming home after a very heavy day in the hospital, we were not able to take the 24 phone calls which came in because a neighbor or a neighbor's neighbor or a neighbor's neighbor's neighbor wanted to connect with you for help during his illness at this time. We also understood that we were hugely facing burnout because the number of working hours was tremendously increased. And at the same time, we were facing a situation where we feared for our own health, our own lives, and that of our families. I do know of a situation where people have even lost their careers because they were unable to handle. Somebody who had mild depression, handling everything well, suddenly realized that they could not, and they ended up losing a career and are seeking new skills to be able to carry on in life. Here was a situation where we learn what is called the second victim. In any healthcare situation, when we handle a patient, be it a nurse or a doctor or anybody else, even the ward boy who may be wheeling a stretcher, but something goes wrong in between, and any harm comes to a patient, there is this phenomenon called the second victim. The patient is the first victim, but the healthcare provider can often become a second victim due to a sense of responsibility that something I did wrong or something that I could have done better might have given this patient a better outcome. This second victim phenomena obviously got deeply enhanced during this pandemic when we were working in more stressful and difficult situations. So, while we are dealing with all this, now at a personal level, how can a healthcare worker protect himself, look at healing himself? So, I think we need to re-emphasize that all of us need to be, helping ourselves by ensuring that we exercise. I mean, I think we all understand that keeping a certain amount of exercise going will keep all our healthy hormones and happy hormones going within us to keep us going well. We need to be able to understand that activities like yoga, pranayama can help us greatly, that we need to ensure we spend quality family time along with our loved ones. And as I had been once explained to by a spiritual leader, that every healthcare worker is working in an environment of negative energy, needs to go back home every day, rejuvenate, get rid of that negative energy, rejuvenate himself, and come back with positive vibes again to handle his situation as a doctor or a nurse or a ward boy or anybody. So therefore, we need to learn to start focusing on ourselves. People have gotten too used to working 18 hours a day, 20, 14. It has been just so routine. Somewhere, while we need to put in our best, we need to be able to give time to ourselves. And all of us who are leaders of team, and we must ensure that this is adequately provided to people. So this is the way we can do it for ourselves. Now, what do I do if I lead a team? I may be having a certain number of doctors working with me and a certain number of nurses, etc. I think the most important thing is that every team leader, while while through the pandemic, needs to be well connected with his team to understand what is going on in the mind of every member of the team. We should be able to quickly identify a situation which may have the potential to affect the health of the healer. For example, when I am in the intensive care unit and a bedside nurse has done something which may be a little bit of inappropriate, for example, a medication error, a drug which was to be administered at X time was delayed by 2 hours. So obviously there is a situation at the time of rounds as to why she has made this mistake. So while we need to correct, identify, incident report, do a root cause analysis and educate, I think we need to learn to deal with her in a most empathetic manner so that her health, her self-esteem remains intact at all times to come back for a better day tomorrow. And this was especially so during the pandemic. So what we found was that when we move in to take a round, the nurse was often not able to remember exactly what she did or what was the last blood sugar. We were working with two masks, we were working inside a PPE, there was a shield in front of you which kept getting fogged, you were unable to even see well. So in such times, it was very important for us to be completely empathetic and understanding towards the nurse who was trying to do her best in that most difficult situation. We had doctors. There was a fear. Before the first COVID patient came into our unit, and when we knew this is largely a respiratory illness, when we will need to intubate, there was a buzzing, hovering fear as to how it's going to get done because we are going to be exposed. We didn't even know how to wear our PPEs properly at that time, before the first wave even came in. And I think a lot of us who got infected actually got infected maybe because of inappropriate doffing that we did. We really were not so good at it at that time. So in such situations, I'm happy to say, however, that when the situation demanded it, it just happened because you are just trained as a nurse and a doctor to do what needs to be done for your patient best at that time. And therefore, this healer stepped forward and did what was needed for the first patient who came in such a situation. The first having been done, well, the rest were all a cakewalk because, the precedent gets set, your management stands with you. Every youngster in the team understands that his role is first towards his patient, and therefore the work just carries on. However, we did go through these situations where we felt that often we may have lacked the knowledge. The Ministry of Health and Family Welfare kept updating us with the latest clinical guidelines and what they would want us to use most appropriately. And these updates, however, did come to us. And therefore, as a team leader, it was important, and it is important for each of us in those roles to ensure that we kept passing on this and giving this information to our team so that we could deliver the best towards our patient. So that no healthcare worker at that time at the bedside felt that he may have a lack of faith or a lack of information, and he could be confident about his knowledge base, his education, his ability to be able to take decisions for these new set of patients that we were facing and go for his job with total confidence and spirit. In between all of this, it was important for every team leader to identify those who were somehow not able to cope as well and who might have needed psychological support, as well as those who were hesitant to initially say that they were perhaps not feeling too well, a low-grade fever, because in normal situations, every healthcare worker will just come back to work. I mean, people don't sit at home for when they have a mild illness. But here it was important to convince them that they must tell us early so that we can take it forward, provide them their rest, quarantine, etc., and move forward with it. We were very particular about trying to stick to the protocols as best as we could, and also using a very good, robust referral system wherein we could get the specialist doctors, etc., as per requirement for every patient. So during all this, it was very important to keep the spirit of every member of the team up. We found that suddenly, in the first wave had just begun, and a couple of weeks down the line, we find that the strength of the team is down to half because so many nurses, so many doctors have already been hit by it and now have been quarantined. So it was important to keep that team spirit going so that the rest could take on the work, shoulder the responsibility, and carry on while learning from the others who suffered on how they can better protect themselves to carry on. It was important that each healer, each healthcare provider not feel at all that he is being burdened with extra work while somebody is sitting at home in quarantine if the disease was mild. I think each one understood that it could have been him or her, and we needed to move forward with our team. The first word being, we need to deliver what is required for our patients. I
Ma'am, I
encouraged
would,
every single team
right, ma'am, I
player
would
to
just cue you in for the timing. We have 1.5 minutes more left.
Okay. Now, when I have spoken about how the individual would handle, and then how, as a team leader, we would handle to protect our healthcare workers, I was moving on to now suggesting and speaking about what our organization did to ensure that we could deliver in the best possible manner at this time of crisis in our country. So I think the first and foremost thing that came from our managing director was that even before the first patient came in, we had had our meetings and we had had certain committees formed. For example, a scientific committee put in place specifically for COVID like I said, as a leader, I took forward to my team, but I also kept getting inputs during the scientific committee meetings, which would update us on what is happening latest all around the world. And of course, as per the guidelines of our own ministry, as to how and what we needed to do at what time. It was a great task because, as we said, we all felt a knowledge deficit. It was a new disease. None of us knew really anything much about it. The second thing, our management, I think, which they worked very well towards and gave good confidence to every single healthcare provider that they would be protected and they would remain healthy, was that a quarantine committee was set up. This committee, from the first healthcare provider who became infected, looked at him or her problems. We were assured of the best health provision for ourselves if at all we needed hospitalization, and we were given adequate rest. And then when we came back, we were reviewed again and then assigned our tasks according to what we could take up. Some people had a mild disease, some had a more moderate to severe disease, and accordingly it was handled. I think this was one of the greatest tasks. Along with that, of course, I am aware that our senior management was on the top of things in terms of medication, in terms of oxygen shortage that was threatening our region, particularly the NCR, to be able to ensure that it came to us. We had moments of terror when we were holding patients on ventilator, on ambu bags and Bain circuits and ventilating them. While in continuous touch, I was with my managing director telling me that the IS officers are bringing in the oxygen and the tanks are getting filled. And there were moments of terror, but with such extreme support from the management. And therefore, I was able to lead my team through it while also ensuring at every moment that they could be protected as best as they could. So I think this is how we put together a situation where we would look at the healthcare of the healer while that healer was trying to handle and manage the most difficult time that probably he would or she would in his or her career. Thank you so much.
Right. Right, ma'am. Thank you so much for that. Indeed insightful. You spoke to us about the health of our healers, from nurses to doctors, and what all they went through, and how really Artemis hospitals took on the challenge. That is very important in ensuring that they really played a role in delivering patient care. Thank you, ma'am. And I now take the pleasure of inviting our next speaker, Mr. Harish Manian, CEO, MGM Healthcare. Mr. Manian has been with MGM Healthcare for the last 2 years and is a seasoned healthcare management professional. In a career spanning 2 decades, he has worked with some of the largest healthcare organizations in both India as well as Southeast Asia. He has worked across geographies and has successfully developed some of the largest solid organ transplant programs in India, being a PNL lead. His areas of interest are operations, business development, transaction and advisory, and M&E. Welcome, sir. Over to you.
A very good afternoon, and I would like to thank the week, the team which has put this whole panel together, and a fantastic event following this. I'm really grateful to be part of this fantastic panel. I think people how I personally look up to Dr. Bilal. I think I've been, sir. It's my privilege to be part of this panel, Rashma ma'am, and Dr. Arvind. So it's been great honor to be part of this panel. I am an only non-doctor. When people said that, what the hell you are doing in this panel? So I said I will try and be part of this eminent group, and try and learn something from all of them, because they are like two big stalwarts sitting there. And I will only talk about my perspective in terms of what we went through. We are an organization which just 2 years old, and that's when we hit with this pandemic. And this 6 months old child was hit with a pandemic which was never seen by anybody else. We could see some really great changes going through. What was our learning? First was that when we saw this happening in December, our hospital actually started functioning from January, and then July was when we actually started taking in patients. And now here comes 6 months into actual operations, and you are hit with a pandemic. Actually, first everybody thought it's a problem of China, and we will support China from India, and we will try and help everybody out. But soon, 3 months, 4 months later, we realized that it's our problem as well. And as things developed, I think the worst part and the good part about this was what we learned out of this is the importance of communication in the whole process as an organization. Very important to get the team together at this stage and put a team which works in a very nimble fashion. As ma'am was mentioning just now, and sir was also mentioning, there were directives coming from ICMR and other government bodies, but the directives was also getting changed in 48 hours. So by the time the hospital puts out the creative, by the time the creative comes out, the creative is obsolete actually. So we had to rework on that. So the team used to go back onto the dashboard and do anything new. So we had a team which was working collectively, especially the clinicians were leading the show, and we were just backing it up in terms of what was to be done in an evolving scenario like COVID. For us, I think it was very, very important. Safety of our employees was paramount, and we never wanted to compromise on that particular piece. So what we did as an organization is to acquire as much safety equipments, and some of the equipments were fancy stuff which we never heard of in before and which were never used. I think in hospital settings, like PAPR system, which was a power generated air purifying system, which is inbuilt into a PPE, which we bought first time so that people can be safe. So we actually took extreme measures in terms of ensuring, as ma'am was saying, there was intubation to be done. Doctors were scared. How do we do that? So acquisition of critical vital equipments and instruments to ensure the team is safe was the first priority as an organization, to ensure that team is up there, available there to ensure we can treat patients. The first wave saw a big lull because nobody knew what to do, because everything dried up all of a sudden and there was no patients. Our occupancies dropped down to single digits, and we were just wondering what next actually. And that's when it actually came up. And the second wave was more of a shock to all of us, the way it actually turned out to be in terms of the way it started pouring into the hospitals in terms of critical patients coming to ICUs and stuff like that. But what happened with us is that we tried to scale up the operations. I think the speed at which every individual organization scaled up their operation during this time was commendable. What it has also exposed is also the weak link within our healthcare system. Actually, we definitely need a lot of investment in terms of healthcare, as Dr. Bilal also mentioned in the past. What actually required in an Indian setting is to contribute a large contribution of GDP towards healthcare. We actually, to the shock of all of us, I think many of us know about it, I think we spend less than Bangladesh as far as healthcare is concerned in terms of a percentage of GDP. I think so as a country which is with a large population, we need to actually look into it. And this time around, the budget has actually looked into it and has given a considerable amount of funding towards healthcare. That's a good sign. That's a noble sign. And I hope that will go into developing more infrastructure and disaster management programs so that these kind of pandemics will not affect us the way it has done this time. Second, with regards to the second wave, what we did as an organization, because being so young, it was very easy and nimble for us to make changes. We could actually develop four or five new ICUs so that people can be accommodated very fast. So the measures were taken, and in fact, some of the major milestones which we could do and use during this time was technology to its best. I think any organization during this time which has invested heavily into technology has always got benefited. I think we could actually do a pan continent, or say cross continent, proctored Berlin heart implant in a hospital for the first time in the world, actually, where these kind of devices were never implanted without a proctor on site. We could do it during peak COVID using, high resolution cameras and proctoring done from US, Germany, and Southeast Asia. And our doctors were implanting the device here, and user sessions were done to ensure that it goes without any failure. So what we could understand from this is actually technology-driven organizations can have a greater advantage as the way forward is actually. And today, as we stand together, I was the one who was part of Manipal when we were doing telemedicine, I think. So at that point in time, it was so hard to sell telemedicine, to go and talk to doctors, sit in front of a computer and have a look at a patient. It was a task by itself. And today, if the statistic speaks for itself, almost 25% of our outpatient volumes have drifted towards our telemedicine consults. And that has happened because of COVID, because there's no other reason why, patients should come for normal, as Dr. Balal just now mentioned, for certain disease patterns, people need not come to the hospital. They can actually stay at home, meet the doctor at their convenience and get treated well. They can avoid the travel, they can avoid the inconvenience of, moving through the city. Everything can be made available. So today, technology has actually enabled them to, adopt. And the biggest change what we have seen is, people above 50 has adopted technology so very well during pandemic. I think that is something was a big gap, which has been, because we always believe this technology is only for the youngsters, and they don't want to use the apps and so on and so forth to get things done. But the greater adoption of what we have seen is almost like a 5-year growth pattern, which the technology which was 5 years ahead of our time, we have all adopted during this pandemic. And a pandemic always, or any major disaster always brings in a business change, or the rules of the business changes and the market dynamics also changes. I think that's the fundamental of any major calamity. And that is what pandemic has done to us today. And the way every organization today is adopting technology is it's just amazing. I think, people are heavily investing into it. And that's the way forward for us as well. And being a new organization, what we had in our favor at this stage was that we had a plethora of technology which was already being deployed in the organization, and they all started kicking in at one phase after the other. We had a tele ICU. Ma'am comes from an ICU background. We had a tele ICU system which was running beautifully. And when COVID happened, we have to just create a control center where we could actually start counseling patients from a distance. And all our doctors were able to view, monitor patients even at their home in a large critical care setting. And we used a technology platform which was already running for our critical care areas and transplant ICUs. We suddenly scaled it up to all the ICUs, ensured that everybody is able to view patients. So we created a command center where we could be able to see patients. So doctors were super happy that, hey, here it is. I'm not losing touch with the patients. I'm able to monitor them very well. Similarly, I think we actually used our internal chatbot systems and also tele platforms which we had to monitor patients in isolation in COVID wards. We had given tabs to everybody, and what we had a control center again for COVID patients separately, where all the relatives used to come and counsel and talk to them directly, and they could meet them and talk to them directly sitting at the comfort of their homes as well. So there were initiatives and there were activities being initiated by the organization like ours, and many more organizations. There were so many examples which we can actually take from various organizations who has taken forward during this pandemic to ensure that people are kept safe. There is adequate support provided, manpower is kept safe, and this pandemic has brought forth the importance of nursing in healthcare. I think that is what I feel. And according to me, I think the biggest challenge what Indian healthcare was facing toward is dearth of nurses. I think over a period of time, I personally feel there won't be any people who will be taking up that as a preferred career option. So this pandemic also has brought in a visible change in our perception about building the nursing platform in healthcare. It is very, very vital for all of us. And I think we need to build that platform because they are the ones who actually make the biggest change in care delivery systems in healthcare. And I think we actually during this period, we recruited almost 30% more nurses into the system so that we can ensure that there is adequate relief given to every worker in the system and nobody is burnt out. So there were adequate measures taken so that people should be ensured they are safe, because we can't sacrifice people at the cost of treating somebody else. So at the same time, we should protect the employees as well. So the measures were taken by the organization to adequately pad up people so that there are adequate rest given to people so that they can serve better. So these are the measures which we took. From a technology point of view, I think everything was implemented to ensure that the last mile connectivity and the patient safety was maintained and people are taken care well. So this was a pandemic which changed the way we do business. I think the rules have changed a little bit, but largely, I think we hope that we come back to normalcy as soon as possible. Fingers crossed, there won't be a third wave, and we have seen enough of it till now. I think hopefully we will sail through this very soon. And thank you for having me, and it was a great part of this.
Right.
Thank you.
Thank you so much, sir. Thank you for throwing light on how technology can be used to its best form and how you all used it. 25%, you said 25% of outpatient
Yes.
went towards telemedicine consults, which is great. And also you carried this high-tech implants during peak COVID period. I think that leaves us with a lot to learn, with a lot to think about. So thank you once again. I will now invite our next speaker, Dr. Arvind Sharma. He is the head of the Department of Neurology, and he's also a stroke specialist from Zydus Hospitals in Ahmedabad. Dr. Sharma is also the Honorary Associate Professor of Neurology at BJ Medical College and Civil Hospital in Ahmedabad, and he's the Secretary of the Indian Stroke Association. He has backed the Clinical Fellowship in Stroke and Neurosonology from University of Alberta in Canada, and he has been trained in cerebrovascular ultrasonography, right, sir, at National University of Hospital, Singapore. He has been published in numerous national and international publications and peer-reviewed scientific journals as well. Welcome aboard, sir. I now move over to you, sir. Yeah, you can.
So thank you, Pooja. And I would like to congratulate the week for making this possible with the eminent panelists on board. And it was lovely listening to all the eminent panelists about the infrastructure, about the collapse of the infrastructure and about the finances, and a lot of people lose their job. I would keep my discussion on the point as a panelist more on the basis of the neurologist and the part of the health of the healers, right? About the stress, about the aspect which they have faced during this pandemic. No one at the outset, I would really like to thank all the doctors and the healthcare workers who has put their hard work, thoughtfulness, and commitment for this pandemic. We all are moving towards going to space, moon, but we don't know that if we don't deal with the infectious disease is not going anywhere. It is from last 1 century, I think nobody has been in such a miserable state for the massive casualty or the disaster where they are capable of managing the pandemic. So the point which I want to discuss here, which the organization, our healthcare workers has faced, and even our hospital has faced, the most important thing in the first COVID wave was the fear. The fear aspect for all of us was great. If I say that I don't have the fear to contract the disease, I will be wrong. So it was same for everyone. It is healthcare worker, it's the people who are coming to the hospital, the OPD footfall falls, the IP footfall falls, everything goes down. So the most important aspect which our organization did in the first wave, when they saw the fear, they start a campaign. As I'm a stroke neurologist, we started a campaign as Mr. Harish talked about the telemedicine. That was the other part where the people not able to come. We did telemedicine, but the campaign for the acute illness, we start, don't stay at home. For acute illness, you have to start that campaign and you have to be there in your hospital, the COVID and the non-COVID as separation of the patients. So that was the most challenging time for us when we were dealing with the patients in the first wave and even the second wave, where we have set up the protocol and the processes to treat the stroke patients and even all the acute emergencies, which we can say. And we have code wide for acute stroke. So when we dealt with the patient, we started with the protected code wide, where the doffing and donning areas were separate. So these are which are the points which we have developed a new systems for our healthcare workers and the doctors. So this is also important, and those who are with the milder symptoms and no need of coming to the hospital, the telemedicine was the boom, and we thank the government. They put it on the gadget and they authorized telemedicine for us, and we are really thankful for that. So coming to the second wave, when the fear has gone, as we all know, if you hear a COVID at 1 kilometer away, people were scared, they were not coming out. Then people started coming out, and then the devastating second wave appeared. So that took toll on the healers. That took toll because nobody can manage 24 into 7, 365 days. We have a very eminent speaker, the critical care specialist, Dr. Reshma. She knows about how difficult it is to manage with their whole team who's working 24 into 7 and 365 days. And there comes the point which we have seen in the healers was the situational depression. So that situational depression is a very impulsive kind where people go in a fact. So that was a need. The organization has to come forward and talk to all the healers and all the healthcare workers about their difficulties. So that was very important, and that was very impulsive kind of thing which the healthcare workers has to deal at that point. So if we talk about the healers, about the healthcare workers and the doctors, if we are sitting here and we talking while during the COVID, the one simple question I asked, how many of them they know about their blood pressure? You ask them. I'm 20-year-old, I'm a nurse. Why I'll check my blood pressure, right? I'll tell you one example of the patient who come to my outpatient clinic about the migraine. What I do, I tell them about the 3 lifestyle modification. Do you sleep 6 to 8 hours? Don't keep yourself fasting, and keep your screen time within a limit of 2 to 3 hours whole day, and don't switch off your light and see the screen. So what I preach, do I practice that? So that is the most important thing. We preach a lot, but we don't practice. So it is very important that the healers should know about their health, and they, as all the eminent speaker rest all have talked about the infrastructure, and they have talked about the health, about the exercise, and all the aspect of the good healthy lifestyle modification. But I should tell the healers that they should take care of their health. They can work an extra hour, but they should know about their physical fitness, their mental fitness, because WHO also have said the health is the complete physical, mental, social well-being. So that is very important even for the healers. And at the last, I will quote Aristotle: health is the matter of choice, not a mystery of chance. Thank you.
That was very well said, sir. The healer has to know about their own health. That is very important. How the healers can heal themselves. They need to practice what they preach, and health is complete. It's an overall complete well-being of a person. It cannot be just said that health is emotional health or limited to physical only. So that's a very big lesson, I think, for all of us, especially for our healers. Thank you for sharing that with us, sir. So yes, I thank you all for a very rewarding session, and we now move on to the audience questions, of which we have so many, but I am afraid we do not have that kind of time that we can take all of them. Hence, let me pick and choose. There is one by Mr. N.G. Bhagwat. He asks, how do you manage to, offer quality and affordable healthcare in the face of an unprecedented COVID crisis while not compromising on patient satisfaction? Who among you all would like to take that question, please? Right. So who among you all would like to answer that question, please? How do you sustain patient satisfaction and how do you offer affordable healthcare, especially in times of a COVID crisis? Yeah. So Ms. Tiwari, Ms. Reshma Tiwari, would you want to go ahead? Because you unmuted.
Ah. I thought I should just be unmuted. So, Pooja, I think, of course, this question would be well answered by the likes of Mr. Harish or Dr. Balal, because they are actually at the
Right.
forefront of deciding such policies for their
Right.
organization.
Okay. Right.
However, as the front end person, I would just say that, in Haryana, we had it from the government, the capping, so we just had to handle it that way. And from my side, it was a repetitive, advisory to every member of the team that
Right.
just because prices have fallen, etc., affordability, we can't let down what we need to provide and the best we can do for our patients. So
Right. So
that's
I think
all.
we will let Mr. Manian and Dr. Sharma both answer the question. You all can both give your perspectives because we may not be having the time to really take more audience questions. So let's go on with this. Mr. Manian, you can go ahead first, please. Sir, you are on mute, sir.
So my perspective on affordability of healthcare during this
Yes.
pandemic was, I
Yes.
think, as ma'am very rightly said, some of the commodities were actually gone into kind of supply chain constraint. In that particular point, price gets inflated actually, and there is government stepping in and trying to ensure the supplies are equitable and at that point in time, and the prices are regulated. Was the first move which ensured that people are not getting overcharged by anybody. Is it a private enterprise or it by a small time supplier itself? So because there was a whole lot of hysteria about this remdesivir medicine in the market, and people were just selling it for 5 times, 10 times, and and PPE masks or short supplies. So there were so many issues that one after the other which was following. And there was also something known as people were doing some kind of a safety stock at their homes itself, because whoever could have access, they could have bought at least 3 or 4 vials of remdesivir and kept that at home, just in case I got a COVID and I can use it, because that is the kind of hysteria it reached actually. But as an healthcare organization provider, I think there were regulatory bodies who were ensuring that prices are maintained at a certain level. That is one. And we were delivering whatever best possible from our side, ensuring that the prices are at the same, because there was no major changes which has went through apart from the normal critical care charges which were going to be levied on a patient whenever he was there, and in a ward, whatever it was there. So we ensured that the prices are nominal to what we are providing at that particular stage. And the regulated price points were also passed on to the benefit was given to the patients. So that's why I think it could be kept at a nominal level. I think that's where most of the organizations did, and they actually tried to control the price.
Right. Thank you, sir. Dr. Sharma, would you like to add to that? And then maybe I could take a question for Dr. Balal. Sir, you are on mute, sir.
Dr. Bilal will be the right person to talk about it.
Right. Right. Dr. Balal, maybe you can continue, then I can come to Dr. Sharma later. Yeah.
There are two aspects to the question.
Yes.
One is how do you
Yes.
maintain quality medical care? And the second one is how do you make healthcare affordable during this crisis? So the answer to the first question is you can only do the best under the circumstances. It was a national calamity, and you cannot ensure the same standards of care in a crisis as you would do in an elective procedure. Even countries, well-developed countries like the US, had ophthalmologists and orthopedic surgeons running the ICU, unlike Dr. Tiwari and experienced people running the ICUs in India. So in a crisis, you have to do what is best possible to save lives, and there would be some compromise in quality, and that is because we had to save more lives than just ensure quality. That is the answer to the first part of the question. The second is affordability of care during this crisis. And this is probably the only time I have seen where quality medical care was assured to every citizen, rich or poor, at a very, very 80-90% of all private sector beds across the country were dedicated to COVID at a rate fixed by the government. So healthcare was delivered at a rate fixed by the government to a majority of the citizens. And this is the first time this happened. I think we as a private sector, the government and the public, if we work together, we can come up with these scenarios even for the future.
Right. Thank you, sir. Dr. Sharma, I would like to ask you one question, and I, would request you to really give us a answer to that. Did you see a fall in the stroke patients, coming to your hospital during COVID? And maybe very quickly, if you could throw a light on that, please.
Thank you very much, Pooja, for that question. I discussed that part in my talk, that in the first wave of the COVID, you found the footfall for all the acute emergencies, and
Yes.
stroke was one of it, because we are a very high volume center for a stroke. So we found a lot of decrease in the footfall, because people will think that they will be okay, and they go to the nearby hospital and they think they will contract COVID if will they reach, because most of the hospitals they cover sometimes periphery of 150, 200, 250, 300 kilometers, where they can reach with the to get the treatment for acute stroke for the quaternary center, like the interventions. So that is why we started the campaign. The Zydus Hospital started the campaign, don't stay at home. And that made a difference, because the first wave, it was the fear that people were not coming. And it was a nationwide campaign then on the Indian Stroke Association of don't stay at home. So all the acute emergencies, they were not reaching, but as it was more conveyed by the hospitals, people start doing it. Yeah.
Right. That's right. That is very informative, sir, because we really had so many stroke patients, wondering where to go and what to do. Right. So that brings us to an end of this session, to the end of a webinar with, which has been a truly enriching discussion, in which we got to know so much about the health of our healers during tough times and what the future looks like from now. Thank you everyone for joining us today. But before we leave, I would like to invite each and every one of you, along with our audience who have joined us this time, to please join us at the week's Best Hospitals Award ceremony, which will be starting at 5 o'clock today. That is in hardly 25 minutes from now. And it will be streamed live from the Taj Mahal Palace Hotel in Mumbai, like literally 25 minutes from now. So please join us there. It will also be streamed live on Facebook and YouTube. So yes, hope to see you there, all of you all. Thank you, members. Thank you, panelists. Thank you, the audience. And yes, hope you all have a good evening. See you.
Thanks, Pooja. Thanks, Veek.
Thank you.